Well, hello. I'm going to talk about the disease cholera, which is caused by an agent of biological type called Vibrio cholerae. This is an aerobic bacillus that is transmitted through fecal matter. It is contracted by consuming food or drinking water contaminated by the fecal matter of an infected person. There are many serogroups of Vibrio cholerae, but only two, the 01 and 0139, cause outbreaks, and 01 has been the cause of all the recent outbreaks. Talking about the disease itself, we have two stages, subclinical and clinical. Subclinical is when the patient hasn't developed symptoms, and here we have the incubation period that fluctuates between 2 hours and 5 days. And the tissue changes, that is when, after overcoming the acid barrier of the stomach, the bacteria colonizes the epithelium of the small intestine, mainly through a carb-regulated pilus, and this causes the levels of CAMP, cyclic adenosine monophosphate, to increase thanks to an enzyme released by the bacteria, and this changes the absorption tendency of the small intestine by secretion. And then in the clinical phase, we have the prodromal period, that is when non-specific symptoms are developed, like sudden watery diarrhea, throw up, and dehydration and its effects. And also we have the clinical period, that is when specific symptoms are developed, such as diarrhea with whitish color and frequent vomiting. And finally, the resolution period, that is when dehydration and the loss of electrolytes lead to severe hypovolemia, leading to heart failure due to the lack of volume. And if the patient is not hydrous, they could die. And finally, we have the prevention stages. Primary is always drink boiled or purified water, wash and disinfect fruits and vegetables, and to eliminate places in which the bacteria is known to exist, and also take the vaccine or Dukoral or others. The secondary is to take stool samples in patients suspected of cholera in order to isolate them. And finally, tertiary is to prevent further damage. It is recommended to have constant hydration and rest until the patient feels better. And